emailed me is data that they got during the August Walk Ride Corporate Challenge. And what they found is that overall 12% of people who participated changed to a healthier form of transit, and that 62% of car users actually switched to transit, bike, or walking during that challenge. So while that isn't an everyday event, it does go to show that when you give people an incentive and information and motivation, that you can do this. I'm going to share a story about myself, and I think some of the challenges that we face as we think about how do we get people to change. When I was a medical student, in my second year, I had my first child. I took a year off, but when I went back to medical school to complete my clinical rotations, bicycle was my major form of transportation. So I used to commute from Cambridge every day with the one-year-old on my bicycle to drop him off at daycare, and then go either to the medical school or to whatever hospital I was rotating at. That was a while ago. But as I watch bikers around the Commonwealth today, and I do see a lot of people with their kids on their bicycle, several things impressed me. Number one, that it's actually harder, I think, to bike around the Commonwealth today, especially in places like Boston and Cambridge, because the roads are so congested. And I even felt it was challenging then. But there's also, people are much more aware of safety. If you can imagine that during those 2 years that I used my bicycle as my primary transportation, neither my son or I wore a helmet. And I'm just fortunate that neither of us was injured. But when I look at the traffic patterns and everything that's going on in the city, especially Boston, around Cambridge and other of our bigger communities, and even on some places like we were talking about on the Cape, the roads are narrow, it's hard to do. So this work is really important, and there are people out there who want to participate in these types of activities. The Bureau of Community Health and Prevention, or BCHAP as we call it at DPH, has a number of activities that support these transportation initiatives and give people the information, education, motivation that they need to participate. There's the Healthy Community Design Initiative. Our Mass in Motion initiative is now present in 53 communities. Are there any Mass in Motion community representatives here today? Thank you, thank you. There's also the Massachusetts Coordinated Health Promotion and Chronic Disease Prevention Plan, which has a goal to have 5% of Massachusetts communities establish local complete street policies to support walking, biking, and active transportation. BCHAP has also worked closely with Catherine Cable in promoting healthy transportation, including transportation and chronic disease prevention activities. They have worked to support safe routes to schools, in promoting walking and bicycling across the Commonwealth, and promoting the Complete Streets and Motion initiatives. Mass in Motion, which was launched in 2009, is a major statewide public health initiative that incorporates healthy transportation. This multifaceted campaign promotes mode shift from cars to walking, biking, and public transit. As you all know, physical activity is a key component of a healthy lifestyle, and active transportation is a great way to achieve regular physical activity that is incorporated in people's daily lives. Mass in Motion communities are working to create environments that allow people of all ages and abilities to safely walk and bike. And you notice that I said all ages and abilities. I think that one of the challenges we face as we further this work is to make sure that we're providing and figuring out ways for people with disabilities to also participate in these initiatives. I'd like to take a few minutes to describe some of these initiatives. The design and planning of communities can affect our physical and mental health. Healthy community design includes planning and designing communities that make it easier for people to live healthy lives by providing safe, convenient, and comfortable routes for walking, biking, and public transportation, and that also encourage increased use of these modes of transportation. Some strategies being undertaken by mass in motion communities include the establishment of local complete streets policies, establishing healthy design standards, requiring sidewalks in all new development, and zoning ordinances that require site plans for commercial industrial buildings to provide bicycle accommodation.